Hi, my name is Phil. I like to talk about politics, and in this video I'd like to discuss a leaked paper which shows Public Health England estimating the R value to be at 1 in much of the country, and certainly in some regions, and potentially above it in some areas as well. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, although the government are trying to avoid questions about the value of R, that is the number that represents the average number of people that an infected person would pass the infection on to, by cancelling all daily briefings. They've all stopped now. They began by dropping the weekend ones, now they've dropped them all together. To try and prevent journalists from asking questions of not only ministers but their scientific advisors. But despite all this, they were fairly unequivocal about the fact that it was definitely below 1, between 0.7 and 0.9 in fact. Now, below 1, you can maintain a decline in the spread of the virus, because below 1 means if you become infected, on average you will infect less than one other person. Now, that means not everyone will infect someone. On average, it will be less than a person. That means the whole thing carries on declining. If it's only just below 1, it doesn't decline very quickly. If it's a long way below 1, it declines much more quickly. That's how it works. But if the R value is above 1, then that means on average you're infecting more than one other person. So the number of infections increases, and you have your second wave incoming if that is sustained over a period of time. But the government have been coy about releasing data reports on which their assertions are based. But a report has been leaked from Public Health England, which indicates that the government know that they are massively downplaying the R value. It says that there can be no certainty that the R value is below 1, which means that easing restrictions will surrender what little control we have achieved with the lockdown. Also bear in mind that countries that used their lockdowns to get the R value well below 1, which we clearly never did, observed a predictable increase in the value when they eased restrictions. Obvious enough, really. Until you actually get rid of the virus, it will always spread more easily with fewer restrictions. This is why France took the view that there would be no national easing of restrictions. The lockdown went in nationally, the easing of restrictions, no. That was only going to happen on a regional basis. Germany also took a regional approach, has had to reimpose measures after easing them as well in areas. The problem in the UK is that although Boris Johnson says that he will not hesitate to reimpose restrictions if the infection gets out of control, nobody believes him. And how would he know? Government ministers are keeping themselves deliberately ignorant of the data in order to claim ignorance later on when the inevitable inquiries begin. Ah, minister, you must have known that the R value was at such and such a point. No, I didn't. And it'll be true, because they're not being told. They're telling their aides, don't tell me, I don't want to know. For example, the Health Secretary had to tell Parliament earlier this week that he had no idea how many people were being tested on a daily basis. The data has not been made public for a month. And clearly, senior ministers are also telling their aides not to show them either. They'd rather not know. So the situation is that the government are telling us that the R value is between 0.7 and 0.9, which is still higher than other countries when they ease their restrictions. Actually, you're going to point America out at this point. It's still higher than sane countries when they eased their restrictions. But the report, which was not intended for public consumption, stated that the R value could actually be above 1. In a number of regions, the report says that the R value is actually about 1. The estimate is about 1. So that's what the government have got. The government are telling us it's between 0.7 and 0.9. This report is saying actually we think it's about 1. It also says there is some evidence that the R value has recently risen in all regions. And that is obviously crucial, because where it is in a snapshot in time, could be coming down, could be going up. If it's going up, it makes no difference if it is 0.9. If it's going up, it'll soon be above 1. Now, for those who understand what the purpose of a lockdown is, that would make sense. Naturally, if the purpose of lockdown measures is to reduce the R value, then removing those restrictions will increase it again. However, if you ease the restrictions from a low R value and you've got in place already an effective track, trace and isolate strategy, then you can go with that. You can continue to keep easing restrictions slowly over time as long as the program is working, and where in little pockets it's not, reimposing a few things, fine tune it, that can work. That's not what we're doing. We didn't get the R value down to a low level. A low level would be about 0.5. Even the government have 0.7 as the lower limit of their, what we now know to be false, estimate. As for testing, we know we're not up to date with targets there. If we were, we'd be publishing them. The government are publishing number of tests per day, but not the number of people tested. Now, the reason for that, most of you would think, perfectly reasonably, that isn't it the same thing? If you carry out a test, of course, you're not testing donkeys, are you? You're testing people, so isn't it the same thing? No, it's not. Bear in mind that the government count what they call capacity as the number tested. So a few things that they count as a test. So if someone rings in and says they've got symptoms and they're told, oh yeah, you need to get a test, they count that as a test done without ever checking that the test is done. They count that as a test done. If they do test someone, but they don't record their details, so they can't actually get the results back to that person, well, that still counts as a test done. Oh, and yeah, that happens. And also, as a test the test stick has two ends to it, one to stick up your nose, one to shove down your throat. Well, each test administered in that way actually counts as two tests. It's like, well, there's one up your router and one down your throat. Honestly, they count that as two tests. But like I said, if the government had genuinely impressive testing figures, it wouldn't be keeping them secret. It would be shouting them from the rooftops. They are desperate to be able to shout some success from the rooftops. As for tracing, the less said about that macabre joke, the better. 12 million quid given to one of Dominic Cummings's drinking buddies has now been abandoned because it can't work. Quite why they didn't abandon it months ago when we also knew it couldn't work is beyond me. And isolate, fine, okay, there are rules for isolating. Cracking. The problem is that because we don't have the infection under control, we're going to see a lot of one of the following scenarios. Scenario 1 is that entire workplaces shut down because someone tests positive. This has already happened to at least 2 schools that I've heard of, and we haven't even reopened them properly. 2, people fearful for their incomes will simply not isolate. It's not like it's an easily policeable situation. Besides, the vast majority of people who have COVID are being missed by our tracing system anyway, so the vast majority of people who need to isolate are not even being told they need to isolate. And as if the report suggests, the R value did rise as a result of the last set of eased restrictions. How much more is it going to rise now that the newspapers are basically saying summer's back on? In fact, one paper did say that. With staycations being plugged. It's not even like our dumbest are just likely to go abroad to spread their infections. No, they're going to do it here. And yes, big sigh of relief for all our neighbours, fair enough. But I mean, from our point of view, we might as well put up a sign at Dover saying unclean. And I've said it before, and I'm afraid I'm going to have to keep saying it. I do not see how we are ever going to see the end of this infection in Britain unless a vaccine or a treatment is developed, because our government will never, ever get on top of this. And I believe they understand this and are hoping for a pharmaceutical solution themselves. You can see this in the fact that the only part of this sorry affair the government do seem to be actually putting genuine effort into is supporting international schemes for developing and testing vaccines and drugs for treatment. If it doesn't materialise, and there's no certainty that it will, don't imagine that it has to. It's a hope, potentially even an expectation, but it's not certain. And if it does happen, there's no guarantee it'll be available quickly. We hope it will be, might not. I shudder to think what 2021 is going to hold for us in that scenario. And I wouldn't even consider the political meltdown of Boris Johnson and his phonies to be a silver lining. But those are my thoughts. Let me know yours in the comments below. I hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.